Hi friends, I am Dr. Pratap Rathore. I have done MD in Forensic Medicine. In today's video, we will discuss about treatment of poisoning. Treatment of poisoning starts if the family members or if it is known that the person what type of poison he has consumed or anyone poison which poison he has consumed. If it is known, then specific treatment for that poisoning should be started. If not, then the treatment is usually given in the general lines with no specific treatment. It takes an amount in these steps. First is the restrictive measures. Next is removal of unabsorbed poison from the body. Next, third step is administration of antidotes. Then elimination of poison by excretion. Then symptomatic treatment or follow-up. So any of these steps which has to be followed as a general line of management of any case of poisoning. Coming to restrictive measures, this is done usually in case of comatose patient. This is done to stabilize respiration, circulation, and to correct the sinus depression. That is ABCD of resuscitation is done. So ABCD includes airway, where airway has to be kept open by cleaning up the airway, that is oral cavity, nostrils, of secretions, vomit, or any other foreign bodies, so that the person is able to breathe properly. And next, if the person is unable to breathe, then breathing should be started. If arterial blood gas cannot be maintained in spite of establishing the effective airway, then graduated supplemented oxygen therapy either by venti mask or through endotracheal tube should be administered so that the blood oxygen level is maintained. Next step is maintenance of circulation. So IV fluid is started immediately to which will be a life-sustaining measure so that the fluid volume is maintained. This will also sometimes will help to elimination of poison in cases certain poisons. It will also help in removal of poison also. Next step is the correction of CNS depression. It is done mainly in unconscious patient. The patient is kept in a left side, lie on the one side to stop tongue blocking the throat and to allow fluid to come out of the mouth, which is called as a recovery position. This is done to make it mainly done on unconscious patient. Then other measures to recover the depression is done by giving certain symptomatic treatment is given. Most of the poisoning cases, whether they are conscious or unconscious, recovery with supportive care alone is enough for recovery. Next step is removal of unabsorbed poison from the body. So immediately, if the person is airway circulation is maintained after the airway breathing circulation is then sinus depression is maintained, next we should remove any unabsorbed poison which is present. If the poison is an inhaled poison, like certain gases like carbon monoxide, stairs, the patient should be removed from that contaminated atmosphere into the fresh air. Then artificial respiration oxygen should be given. Then air passages should be kept free from mucus. Then nicotinamide or aminophylline is given as a form of bronchoscopy diuretics in case to remove any pulmonary edema cases if present. Next, if the poison is a injected poison, like given by injection or by snake bite, like in those conditions, ligature can be applied above the wound, which must be loosened for 1 minute to prevent gangrene formation. Local vascular constriction can be also produced by giving adrenaline or immersion of extremity in water at 10 degrees centigrade, which slows the capillary blood flow and limits the absorption of poison in case of injected poisons. If the poison is a contact poisons, means it is if it's present on the body and the skin, contaminated clothes, contact lenses, jewelry present should be removed immediately. If the poison is present on the skin or any wound or it is inserted into the body like vagina, rectum or anal body, it should be removed by washing with water for 30 minutes or should be neutralized by specific chemical if it is known. Ice, if the poison is coming to ice, should be irrigated with normal saline for at least for 15 minutes. This is done to remove any absorbed poison which is present in the body so that it should not absorb. Common example is the organophosphorus poisoning, which is usually done in insecticide spray, farmers insect spray. That poison is present on the skin that has to be removed. It can be easily absorbed from the skin. Next, if the poison is ingested, this is the commonest way of ingested poisons, and this to remove that commonly done is gastric lavage. So gastric lavage is a serious procedure where it is called a stomach wash. It is done by Bovas tube or also called as gastric lavage tube or Bovas tube. So this has a funnel. This is a long tube which has a funnel, and one end is inserted into stomach. And using a normal saline, is the tube is inserted in the mouth to into the stomach, and with normal saline, the stomach is washed repeatedly till the wash is clear. So this is done, and it has many contraindications. This is done in many poisons, and in certain poison it is also contraindicated. This will be discussed in one more video. Then one more method of removing ingestion poison is by giving emetics. So emetics is usually can be given, but sometimes it is usually avoided since the patient may be comatose and cannot be. It becomes the content, gas content may be reabsorbed and can be enter the respiratory tract. So emetics are usually avoided. Next steps is administration of antidotes. So administration antidote is done only when the symptoms or the poison is known or symptomatic symptoms are to remove the symptoms. Certain antidotes are given to opposite of the symptoms. So antidotes are given specific for that poisons. So they can be mechanical or physical antidotes like activated charcoal. So activated charcoal is one of the compound which acts by absorption, and it is useful for many of the poisons. It is used along with the gastric lavage. So with the gastric normal saline gastric lavage, activated charcoal is also used to remove any poison which is present in the stomach. Then chemical antidotes. These chemical antidotes they mix with they combine with the poison and form insoluble compounds. So they usually do not act as an antidote, but they form insoluble compounds with mixing with the poisons, like certain salts or albumins or potassium permanganate, alkalis for acids, acids for alkalis. They are used. So they do not they interact with the poisons and form insoluble compounds and which can be easily eliminated. Then physiological antidotes or pharmaceutical antidotes like chelating agents. These are they're given for metallic poisons like lead, iron, or in case of mercury. So these poison chelating agents act and specifically the opposite act on the centers which are acted by the leads. Then they interact with the opposite to that of action caused by the poisons. Like atropine is given in cases of poisons of organophosphorus, and they are opposite to the action is opposite to that of that poisons. These are the antidotes. Next step is elimination of poison by excretions. So this is done to remove any poison which is present in the blood. So the poison which is already entered into circulation which has to be removed. So this step is followed. This can be done for various ways. One is for renal excretion, which can be given by large amount of fluids. Next is by purging, that is by passage of stools by giving sodium sulfate or other sulfates. Then whole body irrigation, that is giving water. Then typhloid, that is by usually by sweat increasing the diaphoresis. Then alkaline diuresis, that is making the blood alkaline so that usually to eliminate in poisons. Then peritoneal dialysis to remove poisons from the blood. The hemoperfusion to remove poison from the blood also can be used. These are various ways by which poison can be excreted uh, by elimination by excretion. Next step is the symptomatic treatment. So even then, after all the steps followed, if the even the person has some symptoms, those symptoms to contact those symptoms, specific treatment should be given. This refers to adoption of general measures to support the life of the patient and lessen his suffering. The symptoms should be treated on general lines. So there is no specific treatment, but only the treatment like if the person is in a depression, then CNS stimulants are given, like those symptomatic treatment is given. Then last step for treatment of poisoning is a follow-up. So certain poisons, even after it is completely treated, sometimes they have complications. So follow-up is necessary to treat the complications. In cases like if the person is suicidal, then psychiatric treatment will also becomes necessary. And this follow-up is very necessary in case of chronic if the person is constantly having a suicidal tendencies. These are my references. Thank you.